Hello, my name is Ackerley, and this episode will be about explaining pain. First things first, I'd like to cite the sources, this 3-book series by Gifford, as well as Explain Pain, written by Lorimer, Moseley, and David Butler. And then I've also watched several online courses about explaining pain. I'd like to start this episode with 2 rules that have helped both myself when I'm in pain and the people that I work with. The first rule, I'm going to make an example and say it's knee pain, and I am going to say that we're doing a step up. The first thing that I will ask somebody as they do 3 sets of 8 is the pain manageable? So if the pain is excruciating, then we'll say stop. If the pain is manageable to them, I will say keep going and let's see what it does. Now obviously I'm hoping that by the 3 sets of 8 repetitions that the knee pain is actually getting better. However, it may just stay a low level, manageable pain for them, and I will still say keep going. Forget the 1 through 10 rule. As long as the pain is manageable to the athlete, keep going. Now there's a caveat here. The caveat is pick a movement that is fairly non-threatening. And you really have to make that decision yourself. I mean, when people hire me, I try to help them discuss what that movement should be. But let's continue to use the knee pain as an example. What I wouldn't have them do is jump off of a 4-foot tall box and land on one leg. That is clearly going to sensitize their systems. So therefore, we want to pick a movement that they feel is pretty doable, and then as they go, what is it doing? We're hoping that it gets better, but if it's staying a low level manageable pain, that's a big green light, keep going. The second and only rule is the 24-hour recovery rule. Many athletes have trained themselves to not really feel the pain during the movement, so they play the soccer game and they don't feel the lung pain, the quad pain, etc., right? But then when they get in the car or when they stop, that's when they feel the pain. So the 24-hour recovery rule is it's okay that when you're done with your exercise that you do feel an increase in pain, but it should go back to your baseline within about 24 hours. I use the word baseline because I don't want people to think about 100% pain-free. I just want them to appreciate that sometimes we wake up, get a little stiff back or a knee or whatever it is, that's okay. And as they go, if they didn't have the pain during and then they do have an increase in pain after, that's okay too. Exercise is stressing tissues then adapts and gets stronger. It's just that if the pain lasts for days and days and days after they're done, that's when we should take a look at what they did and see if we can modify it a little bit. So maybe 3 sets of 8 becomes 2 sets of 8. Or, you decrease the weight or you slow down a little bit, something like that, a little modification. So to recap really quickly here, pick an exercise that is non-threatening to you, perform a few sets of it so you do have some rest in between, so maybe 3 sets of 8 would be a good little ballpark number. If the pain remains manageable, keep going, that's a green light. If the pain is getting way increased, unmanageable, stop. And then the only other rule is the 24-hour recovery rule. You go through the movement, it feels manageable during, but then it increases. This is okay, but it should resolve back to baseline within about 24 hours. Okay, so I wanted to open up with those 2 rules just for those who wanted to take a look at that and move on. And now I just want to discuss a little bit of how I came to these conclusions. So the first thing that I'd like to discuss is just how movement is medicine. So when you are trying to resolve pain, please think of a movement versus a passive treatment. This has been proven in many studies that it just works better. So when we take a look at manual therapy by itself, whether that's performed by a massage therapist or a skilled physical therapist, by itself, it doesn't work as well as movement. Manual therapy followed up with movement does work. I like movement by itself because I think it empowers the athlete. I have heard time and time again in many clinics that I've worked at, I just can't do this without you. And so the patient becomes reliant on the physical therapist, the chiropractor, etc., to get rid of their pain. They need them. And I don't think that's what I want to do in my practice. I want to empower the athlete. I want to show them that they can perform these movements without me. Now, why is movement an issue, a solver, is a little complicated and we really don't have it all figured out. But in short, when your body senses a threat and you go through a movement, you are either showing it a more threatening movement, so it will increase pain, or you are showing it a safe movement, and so it will begin to desensitize and decrease the pain. I don't want to go too far into depth on this particular video, but once again, just the research is really strong that movement works better than passive treatments, which are ice and heat and just rest and massage. Things that don't involve movement are called passive. So we want a movement. Okay, moving on. So the three things that I'm going to talk about, and there are many, many more, but the three things that I'd like to discuss are beliefs times 2, and I'll discuss why times 2, stress, and situational. So situational was, to me, proven in a study, and I really wish I could remember the particular study, but good news is there are many, many examples of this. So this study, what they did was they poked people, and they poked people saying, I'm going to poke you, I'm going to poke you, I'm going to poke you, and did it with a needle that was very small and had a little stopper so it would always go in the exact same depth, which was minimal, and asked the athlete to report their pain. And then they did the just kind of walk by and poke and ask the athlete to report their pain. And what do you know, but the people that felt more pain, or rather in the situation felt more pain, was when they were told, I'm going to poke you, I'm going to poke you. When they just walked by and poked them and asked them to report their pain, it was less. Now let's think of a fun example of this. So you're on a hike, it's a beautiful day, you're with your best friends, and you have some sort of injury. Let's say you walk by a blackberry bush and you create a small cut in your arm via the thorn. Many of us have experienced this. You didn't feel it. You didn't feel this tissue damage. And so what we start to appreciate is that pain is situational. In a situation where there aren't any distractions and you're very aware of the oncoming threat, you tend to report more pain, such as, I'm going to poke you, I'm going to poke you. You can ask how dentists give injections to little kids. They can tell you this 1,000 times over. You do not show the needle. You do not tell the person, I'm going to do this. And then we can think of the fun ones where we're having a really good time and we do actually cause a little injury to ourselves, but we don't register it. The interesting thing is it doesn't stop with small injuries, and the interesting thing is that pain is so incredibly complicated that it has now been proven time and time again that you can have pain without damage, right? So you're in pain, but there's no damage, proven by CT scans, bone scans, x-rays, etc. And then you can also have the flip side of that, that you have a herniated disc, that you have a knee that's bone on bone, that you have a torn rotator cuff, and that you are not in pain. They've done this. They've scanned people who say, I have no pain, I have full range of motion in my shoulder, and boom, they've got a rotator cuff tear, but they don't feel it. Just let that resonate a little bit. Pain is incredibly complicated. We don't have it figured out. So there's the situational. I mentioned beliefs times 2. What I mean by times 2 is beliefs have an influence on what kind of pain levels that we have throughout our life, or many people refer to this as pain tolerance. In the moment, your belief system is, I believe if I leap off this, say, 1-foot step, that it will hurt my knee, okay? So you already are thinking it's going to hurt before you do the movement. And then what do you know? It usually becomes a self-fulfilling prophecy that you do the movement and then boom, you have pain. Compare that to the world's smallest squat. I believe the world's smallest squat, like minimal range of motion, will not hurt me. And what do you know? It usually doesn't hurt. So the belief system in the moment has been proven. And then the belief system on just how we were raised, how we were brought up. So they've shown that people that expose themselves to pain throughout life, such as a contact sport, basketball, soccer, football, rugby, etc., have a higher pain tolerance than those who were, not exposed to that. The person who never really suffered any kind of, broken bone through falling off their skateboard or getting, hit up against the glass in a game of hockey, their pain tolerance tends to be much lower. And that's all about reps, right? Like as you're exposed to something, you build a tolerance to it, and if you're not exposed to it, you have no tolerance to it. It's also as complicated as how you were raised, too. So as a little kid, if you ran across the floor and fell on your face, if your parent rushed up to you and said, my baby, coddled you, and, told you to just stop playing, then they kind of unfortunately solidified this, like any kind of, fall or crash or whatever is really bad. And so you start to believe that any kind of injury is just horrible. versus the parent that from a distance looks at you and goes, hey, you're fine, man, get up and play. And so then you start to solidify and foster this belief system that you can handle it, that you're tough, that you're a resilient body. And I know sometimes this can sound a little woo-woo, but this does have many documented series of evidence of this. And then the final one was stress. Now, stress probably is going to come across as the most woo-woo one. And by the way, when I say woo-woo, all I mean are things that are unobjectively measured. It doesn't mean that I don't have room in my belief system for them, such as chi, chakra, energies. They're just not able to measure these things. So I want to continue to make videos about things we can measure. But stress has measurable effects as well, such as when something traumatic happens in your life, your dog is sick, mom's not having a good time, something like that, we can measure things such as negative chemicals released in the brain, elevated heart rate, elevated blood pressure, lack of sleep. All of these things as a unit, as a huge system, can elicit more pain. So if you are stressed, you're not getting a good night's sleep, that's your body's time to repair and reboot. You have these negative chemicals going through your brain that are connected to the nerves, that are connected to the tissues, bones, and tendons. And so because of something traumatic happening in your life, you can feel that increase in knee pain or back pain or shoulder pain. And once again, I know that sounds woo-woo, but that has been proven. So when we kind of step back and look at all these things, we see how incredibly complicated it is. Pain is situational, pain is based off of stress, pain is based off of the belief system of how you're raised, as well as the belief system that you're currently in, whether or not you think it's going to hurt, right? And that is just a few examples of how incredibly complicated pain is. Most of us are still going off of this pain model created in 1658 by Rene Descartes that basically said, you put your hand in the fire, the pain on your skin talks to your nerves, goes to the spinal cord, goes to your brain and says, ow. Most of us think of it like that. We think of it as this like one-way circuit, that if you're feeling pain, then something must be wrong. And that is simply not true. I hope that even just one follower of mine, one person that views this video, will have an aha moment of that pain can occur when there's no damage, and no damage can elicit pain. It works both ways. It's incredibly complicated. With this complication, I feel there is some solace, some just like, okay, it's not as simple as I thought, and that's a good thing. Next time you're experiencing some discomfort, try to think of those 2 rules that I talked about in the beginning of the video. Pick a non-threatening movement and try to show your body that there is no threat with this movement, that body part that is bothering you has the capacity to desensitize. Currently it's sensitized. We can desensitize it through movement and start to get a little bit better belief system fostered that not everything means damage, not everything is bad. One thing that I like to think about is how, thank goodness that's the situation, because really we all hit our peak at 18 years of age. That was the prime of our life. From there, everything has been slowly going down. So the cartilage between the femur and the tibia in your knee is slowly decreasing. The disc height in your lumbar spine is slowly decreasing. Joint spaces are slowly filling, aka arthritis. If you've lived life, you have slowly been beating out the shoulder and the hip joints, wearing them down like shocks on a car, and you're on your 500,000 mile. Things slowly wear down, but thank goodness our body doesn't report every little thing. We can have a perfectly healthy day, great feeling, full range of motion, enjoy life with these slightly used parts. So we really need to start moving away from pain is bad, pain means stop. It's far too complicated to appreciate. I don't appreciate how complicated it is, or rather I do appreciate how complex it is, I just don't know everything. So when you think you do, remind yourself you don't. And the last little thing that I would like to leave are just a quick few examples for those who want to listen in, because I have been a physical therapist assistant for the last 10 years. I'm a personal trainer right now. I work about 70 hours a week, so I see a lot of people, a lot of reps. And so I just want to share a couple quick little stories here that maybe will help you. A chronic pain patient that I saw a person who was eventually diagnosed with complex regional pain syndrome was a person who had a fractured foot. This is a normal thing, right? They broke their foot with a real mechanism. They twisted it off a curb. They were in a boot for 6 weeks. When the boot was removed and they put their foot down, they had excruciating pain. So much so that we were concerned that there was still another fracture that was missed in the x-ray, or that the fracture didn't heal. Was sent back to the physician. They re-scanned, showed that the fracture that they originally saw was totally healed, to the point that you should be able to walk on it, and that there was no other fracture. Comes back into the clinic, same thing, excruciating pain with just barely putting the foot on the ground. Revisited the doctor, same issues as far as we can't find anything, did more scans like a CT bone scan, an MRI, no thing that should elicit this kind of pain was picked up on. Now, one more visit to the doctor, and the doctor says, now you're coming down with complex regional pain syndrome. This is measurable. They can see skin color changes, like left foot's red, right foot's kind of white and splotchy. You put your hand on it, there's like a temperature change. So what the heck is going on here? This is a great example of sensitization. The foot that was in a boot for 6 weeks became really sensitive because it wasn't getting gradually exposed to impact and just movement through the toes when you walk. It became really, really sensitive, and when she put her foot down, she had excruciating pain. Now, fortunately, this has a positive story. Because of the background that I had, and because the doctor was able to tell me there was no fracture, we moved forward with confidence. We gradually exposed her to more and more workload, initially just barely putting the foot down, that eventually ended with single leg hopping. That was 6 months later. And she does now have full function without pain. But that's an example of how the damage is gone, but the pain is excruciating. I've also worked with someone who could deadlift a significant amount of weight. That's the bending over with the weight, you're hinging at the hips, which is a very fearful movement for many, many people. And long story boring, when we finally did x-ray her back, it looked like a broken jigsaw puzzle. The discs were significantly degenerated. There was quite a bit of arthritis, and it looked like it was a little cattywampus from some arthritis. And so the spine really on image did not look good, but the function was high. So those are just a couple quick little anecdotes of how I've seen pain be excruciating without any damage, and how I've seen somebody be able to do a lot without any pain. And I just think that we need to continue to remind ourselves of that. We need to continue to read these reports that people have torn rotator cuffs, broken down cartilage in the knee, etc., without pain. We have to appreciate that the body's slowly wearing down, and that's okay. And that being a little bit of discomfort is okay. It doesn't mean shut it down. And we don't want to have that initiation of stop and freeze occur, because this is then going to allow the system to further sensitize. So the next time that you're in pain and you are frustrated with it because it just doesn't really even make any darn sense, try to gradually expose yourself to a safe movement and see how it works out. And this definitely has a exception of if you had a mechanism. So if you fell, slipped, jerked, and something really hurts, that's a totally different situation. You need to check that out first, because your belief system is something's wrong there, and you may very well be right. So we don't want to say go ahead and try some movement there if you just fell and you think you just broke your leg. Get it checked out first. But then once you know the situation, you can start to reconceptualize that belief system into I'm strong, I'm resilient, having a little bit of discomfort is okay. And there's many articles supporting this, so I quoted just a few. If you really care to learn more, there is so much out there going through things like PubMed, Google Scholar, these search engines that produce research papers. There's a lot of information about pain out there, thankfully, and it's very complicated, it's very complex, but remember, you want solace in that. And I hope that helps at least one person. Thank you for joining me.